Hey, my name is Brian, a student at Humber Massage Therapy. So today we're gonna be doing a remedial exercise for a person who has osteoarthritis and is around the age of 70 years old. Okay, so I'm also going to be going through a remedial exercise plan that myself and my partner Nelson Galval have made, and the exercise is going to incorporate endurance. Well, I'm going to be explaining a few endurance exercises. I'm going to be demonstrating a strengthening exercise, and I'm going to be demonstrating flexibility, a stretch for our patient. Okay, so for endurance workouts, I can't show them because first off, swimming I can't show swimming, and walking it's not actually something that I really need to demonstrate. Okay, so the importance of swimming for a person who has osteoarthritis is that there's really not a lot of impact on bones. So we do know that a person who has osteoarthritis has a lot of pain in joints, a lot of swelling in joints due to the osteophyte formation and the thickening of the subchondral bone. Okay, so first off with swimming, a person who is swimming is always being monitored by lifeguards, so you know that they're safe there if anything goes wrong. And second, swimming targets a lot of the body. So one of the main factors of decreasing the symptoms of osteoarthritis is if you lose weight. If you lose weight, then you're putting less stress on joints, especially your knees, which could be very beneficial for a person who has osteoarthritis. And second, walking is just a good way to get your heart rate up. It's a good cardiovascular endurance exercise. The only thing that I don't recommend it with is if a person who has severe osteoarthritis in their knees. It would probably be better if it was more in their hands or maybe like their upper spine when a person is able to walk and actually get exercise from walking. So the only contraindication is if they have severe osteoarthritis in their knees or even in their hips. Okay, so now I'll be moving on to our strengthening exercises and flexibility exercises, and I will be demonstrating them. Okay, so basically I've just gone through the endurance workouts and the importance of swimming and walking for a person who's around 70 years old experiencing osteoarthritis. So now I'm just going to be demonstrating strengthening exercises. So this will be all regarding a person who is 70 years old and has osteoarthritis. So the first one is core crunches. And first off, I'll demonstrate what a normal core crunch looks like, and then I'll demonstrate the extremely modified version for our patient who is 70 years old and has osteoarthritis. See, here a normal core crunch will actually have a person lift up their head and also lift up their legs. But for our elderly patient, we're only going to get them to lift up their legs slightly, and this will be engaging the core. So this is actually very efficient, and it'll be concentrating on the core, and we will get the elderly person to repeat it 12 times and have them do 3 sets, and we'll have them perform this exercise 3 times per week. Okay, so the next one we have is knee extensions, and basically we're going to have the elder sit on a chair with no added weight, and basically we're just going to have them extend their knee and then bring them back to neutral position, extend their knee and bring them back to a neutral position. So it'll promote range of motion for knees, especially if they're experiencing stiffness. We're going to get those knees to start moving and then try and promote the range of motion back and increase the strength in their quadriceps. So we're going to want them to also do this for 12 repetitions, 3 sets, and we're going to get them to do it for 3 times per week. So as I get on the floor here, I'm going to be doing hamstring curls. So For a non-modified version, we're going to get the person to go on a machine and actually add weight. But since our person is an elderly person, we're just going to get them to do it with no weight. And we're just trying to stimulate the muscles here. So we're targeting the hamstring muscles, so the back side of the quadriceps of the thigh. So we're going to target the back side of the thigh. And basically I'm just going to gently lift my legs up at a slow rhythmical movement. So we're going to bring it back down and then bring it back up. So we're also going to repeat this 12 times, 3 sets, 3 times per week. Okay, so that's it for our strength exercises. Now we're gonna move to more specific stretching. So for the stretching, we're gonna be demonstrating how to stretch forearm flexors for the elderly and also forearm extensors for the elderly. So basically, it's just a normal stretch. We're just gonna take our hand. And first we're going to stretch the forearm flexors. So we're going to take the fingertips and extend it back. And then we're going to tell them to do this bilaterally on both sides to hold for 3 seconds. Oh, sorry, we're going to ask them to hold it for 30 seconds and 3 sets 3 times daily. And we're going to ask them to do it 4 times per week. Same thing with forearm extensors. We're just going to take the fingertips and bring them downwards towards the body, and then this will be stretching the forearm extensors. And then we're going to ask them to also hold it for 30 seconds for 3 sets, 3 times daily, 4 times per week. And that's it for our remedial exercise presentation for a person who is around 70 years old experiencing osteoarthritis. Thanks a lot, and thanks for watching.